Murali BK. I'm an orthopedic surgeon and the chief clinician of Hope Hospital and Ayushman Hospital. And today I'm going to demonstrate a very useful tool, which is the Anohra chatbot. We call it the Medi Summary Specialist. I remember a 55-year-old Mr. Singh who had type 2 diabetes came to me and he was using continuous glucose monitoring. Now, every day, the Medi Summary Specialist, or MSS for short, takes a deep dive into his glucose data. It's like having a detective meticulously going through every spike and dip in his sugar levels. Today, for instance, MSS noticed that post lunch, Mr. Singh's sugar levels shot up, likely due to the extra piece of naan he couldn't resist. But by evening, things were back on track, thanks to his regular walk in the park. MSS then wraps up this daily story in a neat, comprehensive summary, which not only helps me as his doctor to adjust his treatment, but also gives Mr. Singh a clear picture of how his daily habits are directly impacting his health. It's like having a personalized medical journal, making diabetes management less of a mystery and more of a manageable narrative. So now I'm going to demonstrate to you. Uh, I have this Mr. Singh who is about 55 years old and he has a medical history of type 2 diabetes mellitus diagnosed about 5 years back. He has a sedentary job, moderate physical activity. He takes evening walks. He is predominantly vegetarian and has a tendency to indulge in high carb meals occasionally. Now, he is on metformin 500 milligrams twice daily. His BP today is 130 85, heart rate is 78 beats per minute, and his respiratory rate is 16 breaths per minute. The BMI is about 28 kilogram per meter square. He's overweight, and his CGM data, the continuous glucose monitoring data for the day, is mm, fasting at around 6 a.m. So let's see what sort of a summary this gives.
Diagnosis: type 2 diabetes mellitus, poorly controlled medication. 1 metformin, 500 milligrams oral, 1 tablet twice daily, long term. Metformin milligram, मौखिक एक गोली दिन में 2 बार लंबी अवधि के लिए. Do sitagliptin 50 milligrams oral, 1 tablet daily, long term. Sitagliptin 1 milligram मौखिक एक गोली रोजाना लंबी अवधि के लिए. Mr. Singh, a 55-year-old male with a history of type 2 diabetes mellitus, presented for a routine follow-up. Diagnosed 5 years ago, he has been on metformin 500 milligrams twice daily. His lifestyle involves a sedentary job with moderate physical activity, mainly evening walks. His diet is predominantly vegetarian, with occasional indulgence in high carbohydrate meals. Today's examination revealed a blood pressure of 185 millimeters per gram, heart rate of 78 beats per minute, and respiratory rate of 16 breaths per minute. His BMI is 28 kilo, classifying him as overweight. Continuous glucose monitoring (CGM) data indicates fluctuating glucose levels, suggesting suboptimal glycemic control. The CGM data reveals significant fluctuations in blood glucose levels, indicating that his diabetes is not optimally controlled with his current regimen. Plan 1: Glycemic control. Considering the CGM data, an adjustment in his diabetic management is warranted. Alongside metformin, I am adding sitagliptin 50 milligrams once daily. This should aid in better glycemic control by enhancing insulin secretion and suppressing glucagon release post-meals. 2. Lifestyle modifications. Emphasizing the importance of dietary management, particularly reducing high carbohydrate meals, is crucial. A dietitian's consultation would be beneficial to formulate a balanced diabetic diet. Increasing physical activity, potentially including more vigorous exercise than his usual evening walks, is advised. 3. Regular monitoring. Regular monitoring of his blood glucose levels using CGM is essential. He should be encouraged to maintain a log of his readings, which will be reviewed in subsequent visits. 4. Follow up. A follow up in 3 months is recommended to assess the effectiveness of the new medication regimen and to make further adjustments if needed. Overall, the goal is to achieve a more stable glycemic control, reducing the risk of diabetes related complications. With the addition of sitagliptin and adjustments in lifestyle, there is optimism for improved diabetes management in Mr. Singh's case.
His today's fasting was 125. Post breakfast was 140 at 8:30 a.m. And his pre-lunch was about 135, and post-lunch 200. In lunch he had two servings of rice, mixed vegetable curry, and one extra piece of naan. Mid afternoon, around 4 p.m., his sugar was 160. He had a cup of coffee with a small biscuit. Post dinner was 155, but pre dinner was 145. And he had a grilled chicken, salad, and a small portion of lentils for dinner. And before bed, his sugar level was 140 milligrams per deciliter, and he did a 30-minute brisk walk in the park post dinner. So, can you summarize this for me and for Mr. Singh?
Certainly. Let's summarize Mr. Singh's day in terms of his diabetes management. Mr. Singh's glycemic control for the day shows a pattern of elevated glucose levels, particularly post-meal. His fasting glucose level was 125 milligrams per LLs, which is slightly above the target range for individuals with diabetes. Post-breakfast, his glucose level rose to 140 milligrams per deciliters at 8:30 a.m., which is a moderate increase, likely due to his breakfast composition. For lunch, he had 2 servings of rice, mixed vegetable curry, and an extra piece of naan. This meal, high in carbohydrates, resulted in a significant spike in his blood sugar, reaching 200 milligram TL post-lunch. This indicates a pronounced postprandial hyperglycemia. Mid-afternoon, his blood sugar was recorded at 160 milligrams per deciliter after having a cup of coffee with a biscuit. His post-dinner level was 155 milligrams 4, which is a relatively good control considering his pre-dinner level was 145 milligrams. His dinner consisted of a grilled chicken salad and a small portion of lentils, which is a more balanced meal with lower carbohydrates. Before bed, his sugar level was 140 milligrams per deciliter. After dinner, he engaged in a 30-minute brisk walk, which is a positive step towards managing his blood sugar levels. Overall, Mr. Singh's glucose levels throughout the day suggest that while he has some control over his diabetes, there is room for improvement, particularly in managing postprandial spikes. His dietary choices, especially at lunch, contributed significantly to the elevated glucose levels. The brisk walk after dinner had a favorable effect, as evidenced by the relatively stable post-dinner and pre-bedtime glucose levels. Recommendations for Mr. Singh. 1. Dietary modification. It's important to focus on a balanced diet with controlled carbohydrate intake. Consulting a dietitian for a personalized diabetic meal plan would be beneficial. 2. Medication review. Given the glucose readings, a review of his current medication, including the addition of sitagliptin, is suggested to better manage his blood sugar levels. 3. Continuous monitoring. Continuation of CGM is advised to keep track of his glucose levels and adjust his diet and medication accordingly. 4. Physical activity. Continuing with regular walks and considering increasing the intensity or duration of physical activity can help in better glucose control. By following these recommendations, Mr. Singh can work towards achieving better glycemic control and reducing the risk of diabetes-related complications.
Thank you, Anohra. That was great speaking to you. I would want to be reminded tomorrow morning when, like, I want you to remind Singh for his daily walk in the morning. So, can you help me in that?
I'm glad you found the information helpful.